Antoinette Nyirumuta is finally getting treatment at the hospital in Kibuye. She's been suffering for days from headaches and stomach cramps. Her village, some 40 kilometers away, has just one clinic and no doctor. Here at the hospital, she can get a proper examination and undergo tests. She would probably not have been treated today if she hadn't been signed up to the country's public health insurance scheme.
Health insurance is very important because it gives us access to medical treatment. Without coverage, treatment becomes expensive. People can't afford to pay doctor's bills on their own.
That access to health care has been enhanced by the arrival of new ambulances across Rwanda. And the decentralized system gives doctors at the hospital more time for their patients. Minor ailments can be treated at one of the 200 or so rural health care centers serving villages.
Each facility also has a doctor present once a week to see the most serious cases.
Antoinette's treatment today will cost her the equivalent of 20 euro cents. The rest is covered by the insurance program. She also has to pay 10% of the cost of her medication.
We want to see more hospitals built. That way, patients don't have to travel such long distances to see a doctor. There are only a few people like me who can afford to buy a bus ticket for the journey.
The hospital in Kibuye is one of more than 40 in the country as a whole. Rwanda has one doctor for every 18,000 inhabitants. Many patients face a long trip just to reach a doctor. Once there, however, treatment is available and affordable. The overall situation has improved.
The changes to the health insurance system mean that people can get treatment when they're sick instead of staying at home. That has made a big difference over the last 5 years.
Rwanda has enjoyed rapid economic growth in recent years. Parts of the healthcare system are now financed by state funding, plus revenue from health insurance. The Minister of Health, Agnes Binagwaho, says healthcare services are now being used by more than 80% of those insured.
We have made progress. People have more uptake of health services and of tools, innovative tools we are providing them, like vaccination, etc., family planning. But we still have a long way to go. And I prefer to focus on what we didn't achieve than to focus on what we have achieved, because we still have a long way to go.
Ruanda in eastern Rwanda is a case in point. The local hospital is now less dependent on foreign aid. The American NGO Partners in Health helped to build the facility. The ward's capacity has increased to 110 inpatients. But most of the work here is now taken care of by Rwandan doctors. Partners in Health still sends regular donations, however, to ensure ongoing improvements to the system.
It starts to help the population, bringing health care and also social support. Even the community, they support them to be much financially capable, because some patients were poor, but they try to help them to sustain their economy by some support.
We work hand in hand with the hospital to support them in areas that they would like for us to be able to support. As we discussed, medical education is one of the areas of need, and for the time being, really supporting in terms of building the capacity of the health professionals is an area that is key.
The dividends from that international cooperation are visible on the ground and in the statistics. Infant mortality and childbirth-related complications are declining. Plus, the proportion of children surviving their 5th birthday is increasing.
For people who are not paying and they're receiving subsidized help, I think the government still has a lot of responsibility to be able to provide to that, because it's actually a lot of people. But I think the mutual system is building up itself to be a strong and sort of autonomous entity.
Back to Kibuye, on the shores of Lake Kivu. The government recently spent about €500,000 on this water ambulance.
We have a plan, what we are going to do, what we are going to do next year, etc. So up to the time we take over. And for the time being, we take over because the aid decreased. Last 2 years, the aid have decreased. But we have increased the quantity of care we are giving. So it's another way to take over. And like we have recruited more than 1,000 nurses. The last 2 years, more than 200 doctors with our money.
The plan also includes making sure that patients in less accessible areas, such as Lake Kivu, can be picked up by the aquatic ambulance.